Hi, everybody. I'm Deacon Carpenter, clinical Ayurvedic specialist.
Hi, I'm Kimberly Karuna, naturopathic doctor, soul medicine coach.
And Dr. Kimberly and I work together here at Well Sonoma in Santa Rosa, California. And would like to talk to you today about post-traumatic stress and trauma. My whole experience this pandemic has been focusing solely on that with my clients and patients. Kimberly, how about for you?
I just want to do a big exhale. Yeah, like um, it's been a really intense time, and I think that the intensity in everybody's current life brings up the compounded, unresolved trauma from whatever happened preceding COVID. So, yeah, I would say so much of my work has been pre-COVID, even on reprogramming the nervous system and helping with a trauma response. But it's even more important now, and I think people are understanding and waking up to the necessity and the freedom that comes from working this way. So, but yeah, like the intensity on the nervous system, even just talking about it, hearing you, it's like, oh, yep, it's alive, it's real.
Exactly. And your ability to exhale, I think, is really important. It's one of those things that I teach my clients and patients how to breathe more effectively to get them out of the into the right nervous system, get them out of fight, flight, and freeze, and get them into rest and digest. And in my experience over the past 9 months, people have just been holding on like that. Um, so tell me a little bit about how your therapies have helped your patients through this pandemic.
Mm. Well, a lot of my special focus is in mental health and anxiety and depression in general.
Mhm,
And so I think it's really first is understanding like what's someone's home base, like where's their emotional home?
mhm,
Because we just turned the volume knob up with COVID, right? So someone's relationship with fear and how that was mediated and how they're orienting towards fear is going to be like fiercely challenged now. And
mhm,
so a lot of it is sort of what what's happening in your body, because your physical body is influenced by this baseline program that's from the brain, that's based on experiences, and all of that isn't like conscious, right? And
mhm,
so
mhm,
a lot of times it's like, well, how are you seeing things? How are you responding to things? How are you responding to how your body responds to things? And
right,
then really figuring out like what are kind of all the things at play? What has I always like to find like people's linchpin, right? Because we really understand that we balance one thing out, like for example, their digestion, their physical body,
mhm,
voila, so much happens better.
right,
Well, then we can go to their diet and say, well, if we stop doing this, then the whole cascade improves. And so sometimes you can work that way in terms of choices and lifestyle and diet or a supplementation. And then
mhm,
sometimes it's much deeper work in the ways that I
mhm,
call soul medicine, where it's like, what are our fundamental beliefs and what are our fundamental choices?
mhm.
Because when we're in trauma, we're in binary thinking. There's no
Yeah,
choice. And
yeah,
sometimes there's one choice, and it's like a life or death situation. I'm either going to
mhm,
do it right, I'm going to do it wrong. And depending on someone's stress response, right? It's like freeze, fight, flight. So it's a lot of times like helping them understand what they do and then working with either somatic type coaching or supplements or herbs or homeopathy, helping
mhm.
them find their ground, find their center.
That's fantastic. I love that, and I love that you use the term soul medicine because it really speaks to kind of how we came to be in our physical and emotional bodies, which isn't really a conversation a lot of Western physicians are having. I mean, usually it's just, oh, you've got anxiety, have a Xanax. And I'm not saying that Xanax doesn't have its place, because trust me, I've certainly taken one or two this pandemic for myself. Um, the challenge in the opportunity is allowing people to express themselves from that place, that place of trauma and those experiences that from the binary brain when we were too young to really understand and cognize how to respond and react in a specific situation. We are doing it from that childhood trauma specifically. Um,
Mhm.
and it's remarkable how those patterns uh, don't adjust. They just kind of give us a roadmap into adulthood. And those are the patterns that I've been working with my patients and clients to, and I love the word reprogramming that you've used. And that's what it's come down to. And taking that full holistic with a W holistic body approach, where it could be diet, it can be lifestyle, it could be homeopathy, it could be somatic therapy. whatever the entry point is for people is an entry point, and that's where we need to start. You know,
Well, and
um,
honestly, what you're saying is so key because it's almost like you take whatever entry point you can get. You know,
mhm,
sometimes when our brain is hijacked so intensely in fear mode, it's going to feel like a threat for someone to or an intrusion for
yeah,
someone to even walk through an open door. And so, you know, it's cultivating safety, as you know, like in the therapeutic relationship.
sure,
um
absolutely.
a huge move, and like understanding what do we do in survival. So tell me, like, I'm curious about, you know, Ayurveda in general. Like,
Mhm.
how do you see that in terms of it disrupting someone's dosha, and how you guide and how you use Ayurveda to sort of reprogram in the ways you're talking?
Right. Interesting question. Well, first of all, the patient has to be somewhat cognizant of a physical or emotional ailment that's coming up for them, which is when they start making inquiry and then wind up by speaking with me. Um, so from the Ayurvedic perspective, if someone has a lot of anger or if there's rash, and being angry means that you're acting rash, so therefore you are getting a rash. That's the Pitta dosha. So that's too much heat, trapped heat in the system. Um, a lot of my patients have been very flighty, very spacey, unable to focus. You know, lots of emotion quickly, rapidly, and that's a combination of expansiveness of space and the mobility of air, which is usually very challenging to mitigate, which is vata. A lot of the diseases in Ayurveda start with a vata imbalance, the disruption of the normal. And then I have one or two clients and patients I'm working with who are very, very morose. I mean, that expression, which doesn't kill you makes you stronger, I think they are tired of hearing. And they're just pulling that gravity blanket over their head and just,
Right. La la
you know,
la la
yeah,
la. Yeah.
exactly. Um, because it's all they can do not to have an emotional breakdown. And I think because of COVID, they don't really realize what therapies or what help that's available to them. Kapha is a combination of water and earth, and when you mix the two, of course, you get mud. So it manifests either physically or emotionally. And in Ayurveda, we say, as is macrocosm, so is microcosm. So
Mhm.
whatever's going on out there has a fundamental impact on your own soul and your own well-being, and vice versa. If you have, as is, microcosm, so is macrocosm. So if you are a family leader or a physician or someone who is giving help to other people, you know, that's going to have an impact on them. If you're not feeling so great, your macrocosm will be affected. Um, so those are the general that's the general focus that I've had this pandemic, and using diet, lifestyle, talk therapy to help people get through it. From the naturopathic perspective, I'm really curious about how stress in the parasympathetic nervous system and the sympathetic nervous system. Let's talk about hormones. How does that affect people and their hormones?
Yeah, well, even I did just a couple things that I have to get out real quick based on what you said. Like, I work a lot with temperaments, right? So
Mm,
things are kind of lined out where there's so much in alternative medicine, holistic medicine. There's different terms for the same things that weave in and out, right?
right.
But what you just described with vata and pitta and kapha is like similar to like the sanguine temperament, or like the choleric temperament with pitta, right? Imbalances and
Mhm,
things like that. But it's
mhm,
also, when I was listening to it, I was like, wow, those are correlating with the primary default response, which will tie into your
mhm.
question of, do you by default go to fight, flight, or freeze?
Right.
Right?
Fight is
Pitta,
pitta. Yeah.
fight, right?
Flight, flight is vata,
Mhm.
and freeze is cut. Holy crap! I never
And
even thought about that.
here's the other thing that's amazing is that you can actually tell not only from somebody's body habitus and things like that, from like what they do, and
Yeah.
that helps tailor so how they can listen to you. I think it's instinctually, like, this is not a cognitive conscious thing that I'm doing, but as I'm listening to you, like, right, we will have, those people will be more prone to anxiety
Right.
than the kapha depression.
Right.
And no one
And
has anxiety without depression, mind you, but like, and vice versa, but
right.
they'll be more connected or resonating with, you know, anxiety or depression. And so in terms of
Precisely.
like the naturopathic with the parasympathetic and the nervous system, I mean, some people, what was it? I was somewhere where there was a little posting, and it said something along the lines of, I'm so used to being tense all the time that when I'm relaxed, I'm nervous. And I was like, God, I totally understand that, because again, it's home base, right?
Mm-hmm.
And so
Mm-hmm.
when we get dysregulated and our
Mm-hmm.
brain gets hijacked and we go into fight flight mode, the sympathetic that's how we're primed. I mean, our physiology is made for us to survive. And unfortunately, when we perceive threat, real or not, our brain gets hijacked in such a fierce way where all survival thinking, acting physiologically will roll out, right? And so
Mm-hmm.
part of what like a naturopathic medicine does is like, you have to want to voluntarily bring in the benefits of the parasympathetic nervous system. And a lot of people are so primed and used to sympathetics because it gives them energy. They're running
Right.
an adrenaline high, or
Mm-hmm.
they mistake being relaxed with being tired.
Mm-hmm.
Or they, are their body is so primed to run on sugar all the time that they don't know how to burn fat. And so then it's like under helping someone really understand, regardless of where you want to go, like there's your health destination, got it, like this is why you want to get there, like we'll never get there if you're not really honest about where your home base is. So like the love and compassion, so we're not flogging ourselves with judgment and like all of these things, like, oh yeah, this is where I'm at, this is how I'm perpetuating my sympathetics, like, oh, I don't prioritize sleep and here's why. And so I'm very, very passionate about building in a treatment plan, not just like, okay, here's what you should do. Because as in your article said, it's like, ultimately, we don't get to determine what someone should do. Someone else gets to determine what level of health they want, what level of freedom they want,
Mm-hmm.
how much they prioritize things. So I just give somebody all their options, and they can kind of take whatever tier. So some people don't want to touch soul medicine, right? And I work robustly where some people, I'm working only on soul medicine and everything else ripples out, right? Like
Right.
their digestion starts to change, their hormones start to change because they're integrated.
Mm-hmm. Mm-hmm. Yeah.
They're regulating their nervous system. And once your nervous system is like primed to cortisol, good luck with hormone balance, right? Because all of your body physiologically will gear towards that at the expense of estrogen, progesterone, testosterone, like bye-bye libido, hello weight gain, like all of bitchy, moody, whatever. And we can blame hormones, and we can even take hormones because we don't need to suffer while we're trying to reprogram and recover. But it's
Mm-hmm.
ultimately just management if we're not addressing like what's putting this in place, and then the importance of how are we participating in keeping it in place.
Right.
Because most of why people stay sick is a lack of information or a lack of empowerment or belief that they can change and do anything different.
Precisely. Yeah.
Yeah.
And I think what I love about the way that you approach your work with your patients is very similar to the way that I approach my work with my patients and my clients, which is if you come to me to lose weight, for example, I'm not going to look at giving you a diet which is going to make you eat, bland food for 5 weeks and fast every other day, because it's not the source, it's not the root of the problem.
Mm-hmm.
Um, the root of the problem usually, like you said, starts with temperament. And when I work with a new patient, I spend 2 hours with them, and they just talk, and they sometimes will sit there and just kind of clam up, and then I say one or two. Exactly. It's like, oh, okay, well, you just showed me all of your treasures here, so I don't need to know about what your weight is and all this other information, because you've already told me where your headspace is. And
Mm-hmm.
typically working with someone for 4 to 6 weeks, if weight loss is, or better weight management is on their goals list, we're focusing on something completely different, and all of a sudden the weight just starts to shed off. It's
Right.
incredible.
It's like
Yeah.
what's really underneath all that, and then the weight loss is the side benefit, right? Because
Precisely.
your hormones change, your digestion changes, like your whole being. I mean, you've probably seen this where you start working on some deeper stuff and people look different. Like
They do.
I have a mirror in my office for a reason. Because sometimes it's even with an appointment and I'm like, holy moly, like something like shifts and it's like it's visible.
Yeah.
Like they can
Absolutely.
feel it and it's a real shift. And um yeah, like it's like the importance of like the deeper ahas that I think we're both speaking to, and how empowering that gets for people. And when
Right.
we're in trauma, like feeling empowered because of all of our, need to feel controls. Cause let's be honest, like we're either closet control freaks or like, outward, overt, covert, or we eventually work on establishing a healthy relationship with control and what that really means. Otherwise it runs our life. But yeah, like helping people understand, like, here's what's really going on, like the big picture. And like, here's all the options of what you can do with it. And then let's talk about what that would look like and what feels like, yeah, I can totally work on that. Because if someone doesn't have that empowered and excited as like, this is an empowered choice versus discipline, and like typically doesn't go anywhere because people aren't like motivated in that way. Right.
Exactly.
Yeah.
And that kind of brings up another segue into the sort of work that you and I do. I feel like, you and I, when we first meet a new patient who doesn't know what we do, we have to spend a good 10 or 15 minutes explaining to them what the practice of naturopathy is or what the practice of Ayurveda is. And I think
I don't do that. I should maybe.
Oh, you lie. No. Well, I mean, it's interesting because I think anytime you put the word medicine onto Ayurvedic medicine or naturopathic medicine, a lot of people have in their head, oh, it's allopathic medicine without the pharmacology. But I feel like one of the big things that we have to do in our profession, in our industry, is kind of help people along the way and let them know that although it's a medical system, it's not the same as allopathic medicine. I mean, if you come to me with a gash in your arm, yeah, I could stitch you up, I mean, with my needle and thread, but I'm not qualified to do that. And then I would rather you go to the emergency room where people who are qualified to do that can. And it's a shift in conversation and consciousness around being accountable for your own health and well-being and really understand what it means to feel well. And when you are getting to the bottom of your cup, how do you refill it? What are those practices and rituals that you can bring in with your naturopathic doctor, with your holistic doctor, with your Ayurvedic doctor, what have you? Giving people the choice, but also the permission to engage with their own health and well-being.
Yeah, I mean, so much to say there about that. That could be a whole nother talk.
That's for next talk. Well, we can talk, like you said earlier, we could talk about this for hours because it's such a hot topic. But let's talk about what viewers can do to help manage and mitigate where they're at right now with their emotional well-being. What are some of the things that you'd recommend? Maybe 2 or 3 things off the bat.
Gosh, I think my last name, right? Like it's really about the healing power of love and compassion. And so it's like, this might sound strange and potentially like woo-wee or like too esoteric, but ultimately when we start to realize how much we are harming ourselves, abusing ourselves in our mind, abusing our bodies with what we do, it's like under sort of the best shift we can do is I focus on what I can do, not what I can't. And like, here's what I want, here's why I want it, and what am I willing to do now, and set yourself up for success. A lot of people who are going to be like, balls to the walls, all or none, they might want to tone that down a little bit because they're going to set themselves up for full reward or full punishment as a pattern if they haven't worked that out. So, I think it's like, be okay with where you are and then get clear on what you want and get support. I mean, we are in an isolated time. It doesn't mean you can't get support. But a lot of people, I mean, I'm a recovering and relapsing perfectionist, and I can do it myself and yet hate feeling like I have to do it myself because that's a traumatizing experience, right? And so to feel like, here's what I'm going to do to support myself. I deserve to not suffer in this space. So it's really about like making just even one choice to say, yes, I need to get help. That alone is huge for people. And sometimes they're in my office, but they haven't quite said yes to getting help yet. Like there's a part of them that is like fiercely in that protection space of, I got to do it myself. Right. And I don't propose to know everything. Like I'm certainly not God, don't want to be God. But it's more of anything that someone tells me, they're telling me, and I'm only able to listen from whatever senses, because I'm going to be reflecting it back them. So they're only telling me what they're ready to hear. I always think, I only know what you're sharing with me, which means you're ready to hear it.
Right.
You know, and so it's like really figuring out what's the one thing that if this could happen, things would feel more manageable. And sometimes it's a hack, right? Like the thing that saves me right now is honestly Juice Plus. Like it's hard to eat good. So I got a little friend. It's produce in a capsule. It bridges the gap, because when I don't eat well, my brain doesn't think well. I don't sleep well. I don't have energy. I start to feel good. All the stress compounds. And when we start to not feel good, it's a vicious cycle. So, you know, like carving out time where I'm laying down and breathing for 10 minutes, especially if I start to feel wound up, is like, that's a gift I give to myself. But if I don't honor that and honor the necessity of it, then I'll just push through and I'll make myself crazier, you know? So it's like finding hacks. Like I'm a big thing on hacks, like how to preserve ease when things are tense. So it's really like finding time to relax, stay in the present moment. Mindfulness is a general, like, I guess that's the way to say one word to summarize: mindfulness.
Exactly.
Loving care, like self-compassion and mindfulness.
That word compassion has been coming up for a lot of people, and a lot of my clients actually, and patients this pandemic. And it was interesting because a lot of what you're suggesting is what I would suggest, which is, you know, get to bed, put away the blue screens, and start to engage with rituals which help benefit your sleep. Because if you're sleeping and you're resetting your circadian rhythm, well, you can wake up early in the morning. I mean, obviously, I know it's darker now than it is in the summertime, but by 7 o'clock, the lights are on, as it were. If you get to bed a little earlier, that means you've got more time in the morning to take care of yourself. Have a self-care ritual. You know, get up and have ginger and hot water and dry brush and scrape your tongue and just
smoking like a true Ayurvedic practitioner.
I know it's like you don't, but I love that. I love your philosophy of hacks, because I say to my patients all the time, once I deliver their program, which by the way is 55 pages in length, which covers everything from pranayama to meal prep. I mean, this is a full thing. They freak out. I always have the second meeting, which I call the negotiation phase, and I'm like, pick three.
Yeah.
You can pick 3 things in this entire program that you can engage with, and that starts the conversation around habit evolution. And once they're in 3 weeks, that's it. You've made it. So definitely focus on the circadian rhythm. Definitely have morning, afternoon, evening rituals where you can take yourself, even having 20 minutes, 30 minutes to yourself without any screens or any phones or any screens to have lunch, for example, you know, and that's another thing.
So I'm putting myself in many people's shoes. And while I listen to you and I, most people are like, oh, like, well, what about just like eating a better diet? Sure, that is absolutely necessary. But if people are more primed in the same, you know, mindset, body mind coherence, they're going to naturally make different decisions, or making the healthier eating decisions. Like it's quicker. It's there's not a huge obstacle versus if you don't have those in place.
Exactly. Exactly.
Yeah.
I mean, for me, a lot of my clients have GERD, irritable bowel syndrome, hyperacidity, sluggish digestion, and they eat what they consider to be a really clean diet. And I'd say for the most part, they do eat a clean diet. However, when you peel back the layer of the onion a bit more, you'll find out that they are eating over their computer and they're shoving food in their mouth, and lunch is complete in 2.5 minutes. Well, digestion doesn't start in the stomach, it starts in the mouth. And now what you're doing by not being mindful, to use your concept of being with the food and just simply masticating your food and getting the enzymes in your mouth around the food, of course you're going to have heartburn. Of course you're going to have indigestion, because your stomach doesn't have teeth. You know,
at least it shouldn't. You know, they're
well, no, exactly. And all the supplements and all the probiotics and prebiotics and hydrochloric acid that you take, if you're not chewing your food properly, then of course you're going to have these other issues. And don't take a Prilosec, because it's going to stop the digestive juices from forming. So So I would say exactly the same thing. It's if you have simple lifestyle diseases or imbalances, start with being mindful around your routines and just take a step back and see we can make edits. You don't have to race out the door and run around like Mario Andretti, which I'm sure you just heard out here. Um,
Okay.
just giving yourself time to get simple things accomplished. That's
Well,
really,
that's what's so amazing, Deacon. So just give yourself time. That's the number one stressor, right? And that's one of the huge
yeah.
limiting beliefs that I fall trapped to all the time. Because you're describing the eat over your computer. I'm like, did you have a computer in my office yesterday? Like that was I fall prey to that too. And
Yeah.
ultimately, it's coming back to, I mean, you and I are both meditators, and there's like life before meditation and life after meditation, right? But
Precisely,
the
yeah.
reality is like, and you don't have to like do it a certain way. Like sometimes it's movement meditation. Sometimes it's
Yep.
just like staying present.
Right.
And I think that, you know, if you don't have time to meditate for 5, meditate for an hour, because,
Right.
and I don't do that. I would love to cultivate a life where I can do that more, plan. But the reality is like, if you feel like there's not enough time, it feels like a train is running behind you, and it automatically activates the sympathetic nervous system, affects your choices, affects your lens, affects everything. Whereas, you know, like chew your food. Okay, well, even just the time to like masticate, you know, like that is telling your body there's plenty of time to sit and enjoy this meal. There's no tiger to come and pounce on you. Like it changes your digestion. And so it's almost like, you know, this magic ninja trick, like let's stretch time. Well, you just have to get clear what your values are. And sometimes it's like when people want to get better, we have to help them see where they're not prioritizing themselves and their health. And it's like, you want to change, you got to move that up. You got to like, you got to move that up on your hierarchy and then link it to action steps, or we can just talk in circles forever.
Well,
So.
that's it. I mean, going back to your concept of hacks, I mean, yes, I love to meditate. I'd love to meditate for an hour a day. It would be fantastic. It's just not going to happen right now. It's aspirational. I remember I was working with a CEO of a company who had hyperacidity and hemorrhoids. And we kind of got to the bottom of it. He would go to the bathroom with his mobile device and get angry at an email and force out the fecal matter, you know. I'm like, okay, do me a favor. Your bathroom, wherever you are, is your sanctuary. Nothing comes in or out, just you. And leave your phone on your desk. And we changed his mindfulness around his bowel movements. And guess what? No more hemorrhoids, no more hyperacidity.
I know, right? Like that's the funny thing. Like it's humbling. Try this. You might be surprised. Like radical things I've seen with just small little things. And then ironically, the small changes are like what we want the most, but our beliefs around how hard it's going to be. And so it's also what we resist the most.
Exactly.
Yeah.
So true.
That paradox. It's like, oh, we have this conscious commitment to really wanting this, but a greater unconscious commitment that's like the sabotager all the time, you know.
And that goes right back to our childhood trauma, where we are in our own narrative, and self-protecting and wanting to do things our way, but we're not. We're doing things that our trauma is narrating us to do.
Yeah. Well, we're always in our own story. That never changes, Deacon. We just get to hopefully learn how to choose more consciously which story we're playing out, and whether that's the one we want or not.
Right.
Yeah.
Precisely. Yeah. Exactly. Well, this has been fantastic. I miss seeing you around the halls.
Nice to see your home, though.
Oh, then actually, I'm at the office. This is the office. Yes, I'm just keeping an eye on things. So Dr. Kimberly and I are going to continue our conversations around health and well-being. We'll do another post in maybe a week or so after the Christmas and Hanukkah holidays. So from us here at World Cinema, we wish you a healthy and safe holiday season, and looking forward to a brighter 2021.